Professor Devi Sridhar. She's a professor and chair of Global Public Health at the Edinburgh University Medical School. Thank you very much, Professor Sridhar. First question, what information do we have on this new variant?
Well, I think right now we don't have much information on the variant. We know first that it is infectious, but we don't know if it's more infectious than Delta. We know that people can get infected, though they're fully vaccinated. We don't know if that's severe infection or it'll be mild infection. And we don't fully understand what this means in terms of health outcomes for those who are unvaccinated. So I think we'll have answers to those, but it's going to take probably 10 days to get more information.
Professor Sridhar, travel restrictions seem to be back. That seems to be our response as we are trying to figure out and get more information on this new variant. It seems to be the very same response. We seem to be mirroring our response of March 2020. How different can the response be this time around, given the fact that we have about 20 odd months of experience?
Well, it's very difficult because we know travel restrictions, that's one of the things we've seen. It can delay spread, but they can't really stop it. And we're seeing that as more and more cases crop up from everywhere from California to South Korea to India. This variant is going to be everywhere. And the question then is it going to pose a real problem for governments, or could it be, let's say, fading away compared to Delta? I think the other lesson is sequencing, having the capability to detect these variants. And we know South Africa was the first to raise the flag to the world, and to be able to have that capacity to be able to test enough samples to understand which variant they are.
Are we aware how lethal this new variant can be?
I don't think we know very much. We have heard of people being infected having mild illness, but these have generally been younger people or people who, let's say the sample's not large enough. It's a handful of people. So I think we'll get that data in the next 1 or 2 weeks. The most important thing will be about its transmissibility. Does it become the dominant strain, or is Delta going to stay dominant? And the second part is around the vaccines.
Yes.
Can the vaccines still protect against severe illness, keep people out of hospital, let them have a mild illness at home? Or will this result in people still getting very ill like they would have before? So I think those are the two things that we're going to have to wait and get more information on in these next 2 weeks.
That was to be my next question. Do we have any information on whether existing vaccines work? Because, one tends to get very conflicting opinion from vaccine manufacturers.
Yeah, so we've had conflicting messages. We know the Moderna CEO has come out saying he doesn't think the vaccine will offer great protection, and then the Pfizer CEO coming out saying he does think it will. Both are making claims without having the real data. The real proof will be when this virus is tested against the vaccines, when we do population studies, look at who comes into hospital, what variant are they infected with, when were they vaccinated with what vaccine. When that is collected for enough individuals, then you can form a picture of actually what is happening in real time with this virus, and we still just don't have that information.
All right, my final question, as of this moment, with so less information on this new variant, you think the only saving grace will be that humble mask?
Well, it is extremely difficult, and in some way it's harder now than it was in January 2020, because in January 2020, we could look at Wuhan. We could look at South Korea and Taiwan, and other countries could see this virus emerging, get enough data out to have some contours of what they were facing. Where this is just, a handful of cases reported first out of South Africa, then many other countries finding them, but not yet kind of a clear picture of what this actually means. So what can each of us do? Face masks when you're in crowded spaces, try to limit your contacts for the next week or two, so you're not around other people, because we know it spreads as soon as people are in close contact. Maybe if you're over 60 or in a more vulnerable group, the WHO has recommended limiting your travel, just waiting, and getting tested if you're unwell so that they can do the sequencing to find out what variant it is. So these are the kind of steps we can do now in the next week or two to just buy time to understand in 2 weeks what's the larger strategy with this virus. Hopefully it is milder. Hopefully it fades away and Delta remains dominant. Hopefully the vaccines are still very effective, but those are still hopefully right now in front of those, not actual facts.
True. Professor Sridhar, Director of the Global Health GP, thank you very much for joining us. Thank you.